Hello, welcome. This is Dr. Ravi Raheja, the Medical Director for TriageLogic. And today, we're going over some potential critical issues related to different organ systems. As I was going through my training as a resident and as a physician, I was taught whenever you had a symptom to think of three real things. What is the most critical issue that could be happening? What is the most common issue that could be happening? And what is the most treatable issue that could be happening? And if you think of those three things, you'll probably always end up in a safe space. Today, we're going to talk about some of the critical issues that can be related to organ systems. So as you're triaging, these things will be in the back of your mind. Now remember, this is not an all-inclusive, comprehensive overview, but it will give you some guidelines as you're triaging patients. So if a presenting symptom is neurological, think about that for a second. Here are some of the things that you should be thinking of. A brain hemorrhage, a brain bleed, like from an AVM or from an aneurysm. A stroke, which could be an obstructive process where they have ischemia to the brain, or a head injury. So these are some of the things you should think of whenever you have a neurological symptom. How about endocrine? Take a second and think about that. You wouldn't want to miss diabetes. And it's very important to have that in the back of your mind because you may want to have them check their blood sugar when you have someone with a symptom. A thyroid storm, adrenal disease. When you have a cardiac symptom, you want to obviously think about heart attacks, so chest pain, very possible. But remember that many females present with atypical symptoms. So you have to be thinking cardiac, even if it's not directly chest pain. Aortic aneurysms is one of those uncommon things, but again, you need to think about it. Orthopedic, there's a few things to think about over here. If there's a deformity after a fall, you need to be thinking about abuse. It's and that may be a serious, or it may be a serious fall, or it may be abuse. A limp is never normal in kids. So whenever you have a limp, it needs to be explained and they need to be evaluated. And of course, we talked about it. Abuse is something we always have to think if there's an orthopedic complaint. Respiratory symptoms. What would be some of the critical things you need to worry about here? Congestive heart failure, asthma, and COPD. And so again, you need to do a good respiratory assessment, document the respiratory rate. If they have a pulse ox, if they're chronic disease, measure that and see what their baseline is. And you always need to be thinking of these things that these could be worsening symptoms of these chronic conditions. An unlikely one is pulmonary embolism, but that is something that you need to think about as well. If they have painless, high respirations, that may be something you need to think about. GI symptoms, gastrointestinal. You want to think of obstruction of the bowel, an appendix, and you could think about a GI bleed. What about OBGYN? What are some of the OBGYN symptoms and things that are associated with them that you'd have to think are critical? An atopic pregnancy is something that you could miss if you didn't think about it. A preterm labor, decreased fetal movement, and undetected abortion. Preeclampsia. And one of the things to think about is that any female of childbearing age is pregnant until proven otherwise. So you always have to think about pregnancy, even if they don't call with the chief complaint of that. Newborns and fever is something very important. You got to think about sepsis. And an important thing is don't miss hypothermia. So people always worry about fever, but a low temperature can also be very, very serious. And make sure you think about that. With dermatology symptoms, you think about rashes. It could be a sign of sepsis in children. Could be a strep rash that needs to be treated. Could be necrosis. And very important, one of the rising epidemics is mental health issues. And we need to be trained and aware of this, that any psychological complaints, you have to ask about suicidal thoughts. There's a potential for abuse in those situations. It could be a manic episode and they could act in a way that is harmful to themselves or others. And those are some of the key things that you want to think about. The most important thing is to have these things in the back of your mind so that when you're talking to somebody, a differential diagnosis is going through your mind. And as a nurse triage situation, you're not going to give them a diagnosis, But if you think of these critical issues, you'll get them to proper level of care so that they can get evaluated and diagnosed properly. Thank you for listening. This is Dr. Ravi Raheja with TriageLogic.